don't really think that that is a good idea because I have a terrible cold. Can you hear that?
Yeah.
Listen, I'm sniffling and I'm not really awake and I'm taking echinacea and vitamin C. I'm sleeping practically 24 hours a day. I have a temperature. And I think I'm contagious.
Well, this time of year, several ailments have the same symptoms, so it's hard to diagnose the problem sometimes. Is it a cold, allergies, or the flu? Here to help us navigate the medication aisle to take care of the symptoms. Welcome back, HEB pharmacist Gina Eubank. Hi there.
Good morning.
This is kind of that mystery time of year because a lot of the symptoms overlap. So you get a lot of people coming into the pharmacy saying, what is it?
Yes, definitely. There's hay fever, there's cold, there's flu. I mean, it's all out there.
Sneeze, all that type of stuff. Of course, with one of those ailments in particular, the best thing we can do is prevention. Before you know it, flu season will be here, so get ahead of the virus by getting your vaccination now. I didn't exactly mean like right now, but we may as well just go ahead and do it. All right, so the flu is not one that I'm worried about because Gina showed up last time and she just had that vaccination right there. Okay, but key is, if you can get the vaccination, do that so you can eliminate that problem.
Exactly, and you know, just about everybody needs to get the flu shot. I mean, and prevent it. I mean, 6 months and younger, you know, infants, they can't get it, but everybody else, especially your high-risk patients, you know, they have asthma, diabetes, cancer, HIV, I mean, the list goes on and on.
Yeah, and you can do that right in the convenience of the pharmacy.
Yes, and HEB, of course, you know, we're giving our flu vaccines, and you can get your groceries and, you know, get your flu shot, and there's no appointment necessary. So.
However, if you do get the flu,
yes,
those symptoms can be pretty tough, and symptoms are typically...
Usually, the big thing that I tell people with the flu is it's rapid onset. Once you've been exposed to the virus from somebody else, you get your symptoms within 1 to 4 days. But when you start having the symptoms, they come on within 3 to 6 hours. And they're intense, hard, and fast.
Yeah.
Okay, so you start running a fever, you've got the body aches, you get the nasal congestion, then you start coughing. You immediately need to get to the doctor. And, you know, you can call the pharmacist and say, you know, this is what's going on, and we'll let you know, hey, you know, get a prescription, because the prescription, you have to get it within 48 hours and start taking it for it to truly be effective to decrease that intensity and duration.
Yeah, because medicine does a number of things. One is prevent something, the other is maintain something, the other is, of course, to go ahead and at least cover up the symptoms, help you get through the symptoms, improve your quality of life.
Definitely, and with the flu medication, that prescription, it stops the virus from replicating. Okay? And so that's why it's so important with that 48 hours to get it, because it's a systemic response. Where with a cold, that's your head and your chest, and hay fever is just in your head, but this actually gets in your blood, and that's why it affects the whole system.
Yeah, hence the prescription medicine. What about over-the-counter flu medications?
They're just simply, you know, helping you muscle through, and, you know, you're going to have the intensity and duration with it. So you need to get it. And back to the flu shot is a dead virus. It will not give you the flu.
Yeah, because a lot of people ask that question. Okay.
Yes.
All right, moving on to, because this is the season here, especially around the Houston area, hay fever, so allergies. Sometimes you can just need to get through the first, you know, few weeks of something. Other times you might need some other kind of intervention. But over the counter, there's like 5 billion things to choose from. So how do we figure out what to choose for what allergy we think we might have?
Okay, the best route is to talk to your pharmacist, of course, and then we can help you navigate. But with an allergy, you really want an antihistamine, because the way an antihistamine works is it covers up the mast cell so it doesn't see what it's allergic to, and it doesn't spill all that mucus out and cause congestion. Yeah. So that's key. And examples of antihistamines: Benadryl, Claritin, Zyrtec, those. You don't want to add the decongestants. And I like people to get on, when you look at the cough and cold stuff, I like for people to get the individual, like get a plain antihistamine, get a plain decongestant.
Yeah, because we oftentimes will go in and get the one that seems to solve the problems of the world.
Yes,
they're like in one box, right?
Yeah.
But then that means that sometimes you're taking something you don't need to be taking if that's not your issue.
Yes, and it can make some symptoms worse. Like if you're having a sinus infection or headache, taking an antihistamine, it's just going to make it thicker up here and increase your pressure and make you feel worse.
Okay, and then finally, the old common cold. We can't avoid getting it, but we can try things like not hanging around sick people, washing our hands. But in the event that we need our over-the-counter medications, what's best for that? What do we look for?
Over-the-counter, first thing, start with some coldies, and because you usually start out with a sore throat, and that'll decrease the intensity and duration of it. Of course, take good care of yourself. Stay away from dairy. Dairy increases the mucus formation of it. The reason they haven't come out with a vaccine for the cold is because there's so many variations of the virus, and that is the most common infectious disease out there, is the common cold.
Yeah.
So come see us and we can help you navigate the OTC aisle and figure out, cold, hay fever, flu, what to do.
Right. And the best thing, of course, is to try to be as healthy as possible.
Yes, definitely.
Right. Gina, thank you very much. For more on HEB's information on all things pharmacy related, you can log on to heb.com/pharmacy. When we come back, no, this is not CSI Houston. It's the latest in skin analysis and profiling. It's totally cool, inexpensive, and available now. We'll show you how it's done. Basically, this is what lies beneath someone's skin. The sun damage they did years ago is coming to the surface.